Good afternoon. Thank you, Riverstone Health, for hosting me today. And apologies, I'm not the first Montanan that got stuck behind the train, so apologies for the delay. You know, I've said before that local public health officers or local officials haven't asked me to put in stricter measures than what we have now. But I've been asked how we can ensure that the state and local measures currently in place can be enforced. I've heard from a wide cross-section of Montana, including John Brewer with the local chamber here with us today, that compliance with common sense safety measures is sometimes wanting. I've heard from schools and hospital leaders and doctors and nurses on the front lines, as many Montanans have, that we're in for a long and rough road ahead if we don't get this virus under control, and that we need to do so by folks taking this seriously. That long and rough road is more hospitalizations and deaths, and fewer hospital beds available. It's healthcare workers even more strained than they are today. We can slow the spread of this virus if we take it seriously. But we need every Montanan to take it seriously. Because just one person with COVID-19 in the wrong place at the wrong time can spoil the whole bunch. We've seen it from gatherings large and small where social distancing and masking aren't being followed. We've seen it from employees who have to go to work sick, or from a crowded night at a bar open past 12:30. There are a great many businesses who are taking the right actions to protect their workers and customers by masking up, by social distancing, by disinfecting, and all the common sense measures to protect our fellow Montanans. But again, just one business not complying with the public health measures puts an increased risk on everyone else who's doing their due diligence to be safe and keep others safe. It puts our families at risk. It puts our healthcare workers at risk. And it puts Montana businesses at risk when their workforce falls ill. Many of our communities are experiencing community transmission, and the virus will keep on spreading if there are no protections in place and no accountability to the restrictions that we already have in place. I've heard from many Montanans that they're worried about the health of their community. One place I've heard significant concern from is the Flathead area. In the last month alone, the county has reported over 1,700 cases, 503 new cases in the most recent reporting week alone. I've heard from hospital leaders from the area that the situation is getting serious and our healthcare workers are stretched thin. I've heard from business owners that want to stay open and not lose employees or customers to this virus. So on Tuesday and Wednesday this week, state public health officials took a close look at many businesses across Flathead County to ensure that we're doing our part to slow the virus through common sense mitigation efforts that are in place all across our state. The teams conducted observational site visits at various businesses in and near Big Fork, Columbia Falls, Kalispell, and Whitefish. The observation sites included gas stations, convenience stores, restaurants, bars, markets, retail stores, and grocery stores. Many businesses were doing well and are helping keep their customers and workforces safe and healthy. To those businesses doing your part, thank you so much. Some businesses had minor issues such as no signage, but the majority of the customers were wearing masks. And other businesses who had complaints that had been filed about even before this week are just not keeping their customers and their staff safe. Employees and customers weren't wearing masks or following other public health measures that are helping prevent the spread. And these businesses are putting people at significant risk. We know how quickly this virus spreads, and as Montanans, we should always put the health of our own employees, friends, and neighbors first. At the locations where public health officials witness actions that placed other people at risk, the state health department will be bringing enforcement actions against them. These were the most egregious of cases, with previous complaints reported and documented as repeat offenders. The goal here is to make sure that businesses are following the measures we need to keep folks safe. If businesses come into compliance, we'll gladly drop the enforcement. Additionally, starting today, we've launched a new website that allows citizens to report their concern about businesses and events that have not complied with directives intended to protect everyone. All Montanans deserve a safe community and a healthy environment, and reporting these concerns means we're watching out for each other. The concerns submitted to this website will be reviewed by the Department of Public Health and Human Services, then sent to the appropriate local authority for review and investigation. Information received will be added to an existing database that's used to track other consumer health and safety complaints, allowing the state to track cases with numerous complaints and follow up on the most egregious of ones. The complaint submission form will be available on the homepage of the Department of Public Health and Human Services website. While the enforcement actions this week are focused on Flathead County, we are working with other counties and do continue to extend the offer that I made last week of providing support to county attorneys and local public health departments of making state resources available. Yellowstone County, including John Felton and County Attorney Scott Twido, have been great partners over the past week in formulating a plan to provide more resources to assist with compliance. Through the state's Coronavirus Relief Fund local government program, I've committed the state to covering the expenses to ensure that these dedicated officials in Yellowstone County can focus on what matters most, and that's slowing the spread of the virus. With that, I'll turn it over to John Felton.
Thank you, Governor Bullock. It is indeed a pleasure to host you at Riverstone Health today. The COVID-19 pandemic has vividly shown that it requires all levels of government, federal, state, and local, to communicate and work together to keep the people safe. This pandemic has also created tremendous needs for public education and information. At Riverstone Health, we receive dozens of calls a day from people who have questions, concerns, and comments about this new and too often deadly disease. Riverstone Health also receives and documents citizen complaints alleging violations of COVID-19 emergency directives from the governor and Yellowstone County health officer orders. Since the beginning of October 2020, we have received at least 176 complaints. Since the pandemic began in March, we have logged more than 1,300 complaints. We forward our complaints to the Yellowstone County Attorney's Office, and that office does the follow-up and investigation. We have focused on educating individuals and businesses that are reported to be in violation. Everyone needs to comply with our COVID-19 prevention directives for them to be effective. When individuals, businesses, and organizations fail to follow these directives to a T, they increase the risk of spreading this disease. This educational response to compliance issues has been Riverstone Health's approach with licensed establishments for many, many years. The number of people in Yellowstone County who have been infected with COVID-19 continues to grow. This month alone, 2,173 Yellowstone County residents have become infected. In total, since the beginning of the pandemic, 82 of our residents, including 15 in this month alone, have died. Last week, our average daily infection rate per 100,000 population was 67, meaning that the average number of new cases being reported each day in Yellowstone County is greater than 100. Clearly, we all need to step up our efforts to individually do what we can to prevent more illness and more death, and we need to do more to enforce the governor's directives and our health officer orders. Last week, after Governor Bullock offered local agencies federal CARES Act money to encourage compliance, I worked with the governor's office to create a plan. Our plan is to hire 4 people for temporary jobs titled COVID Education Liaison. These liaisons would need to understand Montana law on confidentiality and investigation, so candidates with law enforcement experience would be preferred. These liaisons would work in pairs, contacting the subjects of complaints, whether businesses, individuals, or organizations. If the liaison does not validate the complaint, no further action would be taken. If they do validate the complaint, the business, individual, or organization in violation would receive education about compliance expectations and guidance on how to demonstrate compliance. That business, individual, or organization will also be informed that an unannounced follow-up visit will occur. If a second visit validates the complaint again, evidence gathered by the liaisons would be turned over to the county attorney's office and to me as county health officer. We see serious need for this stepped-up response to complaints in Yellowstone County as we try to slow down the surge of COVID-19 cases. I appreciate the governor's announcement today that he will provide funding for this project. We will hire our COVID liaisons as quickly as possible and put them to work to help protect public health. Governor, I want to thank you again for joining us at Riverstone Health today. I'm now going to turn the podium over to John Brewer, President and CEO of the Billings Area Chamber of Commerce. John?
Thank you, Mr. Felton and Governor. There are 8,500 businesses in Billings, and the vast majority of them are listening to the medical professionals and following local and state directives. They're doing their part to improve the health of our community and the health of our economy. Most are doing everything they can to keep their doors open and our neighbors employed, all while showing support for fellow businesses and doing what they can to slow the spread so they can resume full operation. The Open and Safe Pledge, developed by the Yellowstone County Economic Recovery and Response Team, is an optional and self-regulating pledge many businesses have adopted, and we must support those businesses that have gone above and beyond. Unfortunately, even after multiple communications and notices from our health officer and county attorney, a small number of businesses continue to disregard health and safety mandates, such as observing correct hours of operation, maintaining physical distance, and wearing masks. Our position at the Billings Chamber of Commerce is that in order to keep the business community at large open, as well as to get the high number of positive cases under control, there must be enforcement behind local and state mandates. And those businesses that continue to ignore safety measures should be held accountable for the betterment of the entire community. When a business accepts and even in some cases encourages their patrons not to follow health orders, they're putting us all at risk, and the time it takes for us to continue to normal will be extended that much longer. The Billings Chamber joins the Montana Restaurant Association in encouraging enforcement of the existing rules before imposing even more onerous rules on the law-abiding businesses in Yellowstone County. So thank you to County Health Officer John Felton, County Attorney Scott Twido, and the Governor's Office for working with us to find a solution to enforce the mandates designed to reopen our economy and reopen the Big Sky. Thank you.
I'm not sure how this. Thanks, John Brewer and John Felton. Now open up for questions. You all don't have a queue, do you?
No.
So, not sure how we handle questions if there's a lot of folks on. Maybe somebody just speak up first.
I have a question. I guess it's mostly for John. Just if a business is found in violation a second time, you said they would it would be turned over to you or to the Yellowstone County Attorney. What kind of possible penalties would that business then face? What kind of action would be taken at that point?
We'll work with the county attorney's office to determine what the best next step could be. There are potentially criminal sanctions that the county attorney could take. There are also the authority of the health officer does extend to closing buildings or organizations or canceling events if that's necessary to reduce the spread.
Hey, this is Mari with the Billings Gazette. I had a question for Steve Bullock. I know that last week you had talked about providing these funds to provide more resources to public health departments in the state, and I was just wondering why now rather than several months ago to provide this relief?
Well, Mari, there are two different facets of it, right? We provided an additional about $5 million for our public health departments. And that was the result, by and large, of, well, Riverstone was one of them that said that the money that they got initially through this pandemic to assist in everything from contact tracing to the duties that they do, that money has now been exhausted. So the initial $5 million was certainly to ensure that our public health infrastructure, as we do continue to see increasing cases and haven't seen any additional action at the federal level, can do the good job that all of us in the state are counting on them doing. And the other piece that we announced within the last week or so, which, and again, I commend both the public health officer business here and the county attorney's office, the way that they've been saying, how can we do a better job with enforcement? And maybe just to pick up also on that last question, that by and large, what we've seen time and time again, by and large, it's the civil enforcement. It's making sure, like all any of us want to do is make sure that people are complying with either the local directives or the state directives. And as John Brewer noted, the vast majority, I think, of businesses are. But it almost becomes a disincentive when some are willfully not. But Mari, to the second question, one of the things that we had heard from some communities is that they are resource constrained when it comes to actually the enforcement of state or local health orders amidst everything else on their plates. So wanted to use some of those CARES Act dollars to remove those constraints and say, all right, what's it going to take? Because we know that these are enforceable orders at the state and the local level.
Governor Bullock, this is Marisa Giorgio from NBC Montana. I'll just jump in. I'm wondering, you mentioned enforcement actions against egregious violators of the directive in Flathead County. Can you expand on that a little bit about what those enforcement actions might be?
Yeah, Maritza, so for a handful of businesses, we're seeking effectively a temporary restraining order. And to be clear, too, a couple of these, the businesses that we looked at, it was complaint-driven process. Then what we had is investigators, folks, sanitarians, and people in local public health actually take a look over the last couple days at those businesses to see if they were indeed complying with the state directives. Those that aren't, then we're seeking judicial action. And we expect then after that most businesses will actually come into compliance, and once they do, we'll immediately seek to remove a temporary restraining order.
Are you able to say how many businesses?
What's that?
Are you able to say how many businesses?
Probably 5 in total. And as soon as those are all filed, and I'm sure that that'll be a public record. And in the process of filing them today.
Are those citations or actions coming from the county, or are they coming through you, the state?
They're coming from the state level following the actual state directives that we have in place.
Governor Bullock, when we went into phase 2, you said if there was another spike, we could possibly roll back into phase 1. And do you think we've hit that point yet?
Look, I think that the numbers are really, really concerning. And I would say that Montana is not unique in that respect. I mean, we're seeing significant increases all across the country. But we also know, even in a state of 147,000 square miles, we're seeing some further increases in some areas of our state than others. And it's one of the reasons why both keeping local authority, and I commend Yellowstone Public Health for additional restrictions that they put in. And with that, though, also commend them collectively. And when I say collectively, that's healthcare, that's public health, that's business, that's law enforcement. To say, we know what we have to do to get our hands around this. Now, rolling back to going to closing other than non-essential businesses, as an example, is something that I don't think that most states have opted to do yet for a number of reasons, right? One of which is when we did the initial restrictions back in March and April, there was also some federal relief as well as state relief to provide those businesses. And with inaction at the federal level, candidly, the survival rate of those businesses would be that much more challenged. The ability for workers who would be laid off as a result is that much more challenged.
This is Mari again. I had a question for John Sultan. I know last week Scott Twido had said that there hasn't been any action taken against any of the businesses here in Yellowstone County, or at least legal action. But I wonder if that has changed since then. And I know John Brewer had said that there are a few businesses that aren't complying with directives. So I was just wondering about how many of those are in the county?
So, you know, those criminal processes are confidential and within the county attorney's office. So I'm not sure and wouldn't know what's going on in terms of where there are. There have been, to the best of my knowledge, there have been no charges filed. We have done investigations both by public health and the county attorney of some places that we received multiple complaints on. I think that by having these specific COVID educational liaison staff members who can go out with the understanding of how do you investigate, how do you educate, how do you prepare folks to realize that there could be additional sanctions, will help address particularly some of those more repeat violators.
This is Denise Smith, Northern News Network. Governor, this is more of a question for you, looking more statewide. I'm just wondering if there's any validity to considering potentially shutting the borders to the state down at all, like we did in phase 1, especially now where tourism is slowing down and the need for those tourism dollars isn't as great as it was last spring and impacting tourism-based businesses. But I'm just wondering if you've given any consideration to that. Thank you.
Thanks, Denise. But by and large, what we're seeing with the community spread and transmission is that the vast majority of cases, they're not coming from out of state. They're coming from within. And it's both folks at times gathering in large gatherings and small. It's not following all the restrictions or the directives in place. So I don't think that putting in like a 2-week quarantine for folks that come from other states is the way that we actually get our hands around the continued spread of this virus. How we get our hands around the continued spread of this virus is each and every one of us taking the individual responsibility to take the steps necessary.
Governor Bullock, we see the numbers every day. Can you tell us what trends you're seeing, like if more women are getting it than men or age groups?
Do you know Doc?
I don't have the numbers right. I can tell you the website to go to.
Yeah, why don't, so Doc Holzman, also Chief Medical Officer's here, and there was a new epi report put out just yesterday that we posted.
Yeah, I really don't have situation. The only
Go ahead.
The only thing I will say is often we see a lot of younger people, the 20, 29, the 39, and we just got to realize we are all very connected, no matter how much people want to. And when we start to see outbreaks in nursing facilities or other things, a lot of times it's the 20 to 40-year-olds that work there. Those are the people that are going in and out. And now that we know the disease can be passed when somebody's asymptomatic or pre-symptomatic, it's not that they're knowingly going there while they're sick, although we hope people will not do that, but they bring that in. So our actions of what we do at all times has effects on other folks. And so it's just once again to remind people to limit the number of contacts that you have and put in these protocols to decrease the risk all the way around.
Dr. Holzman, I wonder, could you kind of address how the positivity rate has been trending? Because there's a lot of people, I think, are under the impression that the only reason we're seeing so many more cases is just because more tests are being done.
Well, actually, the positivity rate would show us the other way around. In the sense, because what's happened with the positivity rate, we're doing a lot more testing. The governor asked us to have 60,000 earlier in the year by 1 month, and I think we all sweated that we could get that done. We've blown that out of the water as far as how many tests are going. What we're seeing is that the number of tests that you are doing, a higher percentage are coming back positive. And one question that often comes up is, should we even be testing more? And we're trying to max up our capacity to do it. But I think the biggest picture that it's really telling you is the disease is quite heavily out there in some of these communities. And the positivity rate we put up as from the state standpoint, I do believe you put up positivity rates for the individual county too, for Yellowstone. Not all counties are able to do that, but Yellowstone is. And that really kind of gives you an idea of how prevalent that disease is in our community, which gives us even more reasons why we need to work on it really hard, because it will take time. It's going to take, the ship won't be able to turn around right away, but what we do today will have effects in the next 7 to 14 days.
Yeah, I'd only add on to that. So over the last 4 weeks, we did 127,900 tests, I think, or it was north of 127,000. And one of the reasons why, in addition to the prevalence of the disease, like when we were trying to hit that 60,000, we were doing a lot more just surveillance testing, right? That folks without symptoms doing large community events. While we know that anybody could be asymptomatic and still be positive, when you look at where so much of the testing has been lately, it's been around those where we actually know that there was close contact with another positive. So it also makes sense when you have a lot more of the virus in the communities and you're testing people that are that much more apt to have gotten it because it is so much easily transmitted, that the numbers would be that much more significant.
Hi, this is Megan Myskowski with Montana Public Radio. And Governor, I was wondering if you could elaborate on the resources you've made available in the last week at the local level to enforce mandates.
Couple different things, Megan. I mean, we're actually both, in addition to the public health dollars, I mean, we're reaching out and having discussions with local county attorneys' offices and others to say, what do you need along the way? And that's how the partnership with Yellowstone County Public Health and the County Attorney's Office to identify here specifically what we need, and we'll continue those conversations with other counties that are interested.
Governor Bullock,
Governor, I'm wondering if you can respond to today's number, 932 new cases. I mean, just blowing our last daily high out of the water.
Yeah, why don't I first have Dr. Holzman, the Chief Medical Officer.
I think this really just tells you a lot about the virus, and this is what we've been concerned about and what you've heard from John Felton and his team and other local public health officers around the state. You know, disease begets more disease, especially when we don't have any ways that we're putting in, or if there's ways that are not happening to prevent the spread of it. It is an easily transmittable disease, and as more people are out there with the disease, the chance to spread it to many more is there. And so the numbers have gone up exponentially, and it's very concerning. And we don't have a silver bullet at this point in time to stop it, but we have a lot of different modalities that we can do to mitigate things quite a bit, such as the mask. Does the mask prevent every single virus from getting across? No, but it decreases the risk quite considerably. And if people are following that, that helps. Are you doing your social distancing? Are you washing your hands? Are you staying home when you're sick? When a local public health tells you to be isolated and quarantined, are you following those guidance? If all those things were put into place and doing that, we will see those numbers go down. But if there's a good portion or a higher percentage of people that are not doing that, then sadly these numbers will continue to expand. And that's how this virus moves. It just wants another warm body to get to, and if it can get there, it will do so. It doesn't live, although we don't know exactly how long, and it does make a difference on temperature and surfaces, but it doesn't live long outside of the body, and it needs to replicate in a body. So stop the spread from one person to another, and the virus goes down in the community.
I had a question for Governor Bullock on if you have any sense or able to say, you know, in addition to Yellowstone County, how many others might be actually stepping up enforcement actions? You know,
Yeah, I mean, we've been working with Lewis and Clark County as far as getting additional resources, and we have seen enforcement actions in Missoula County, as well as Butte, Silverbow.
When you say additional resources there, what does that mean specifically?
Not unlike what is being done here in Yellowstone County with actual human beings to do either some of the investigation work.
I have a question from our reporter in Helena. She says, I know that MSPOA wrote you a letter just about a month ago, and we know that you responded, but what are you doing now to help them with assistance in jails, and they have been asking for?
Yeah, and we did both provide a response and have been working with and moving jail holds along as we can.
Hi, this is Jonathan Hedinger from Montana Free Press. This question is for Dr. Holzman and John Felton, and I was just wondering if you're having concerns about hospital capacity and morgue capacity. I know, and then also I was wondering, how long are people staying in hospitals, and does that create a concern for how quickly they might fill up?
We're very concerned about the hospital situation. I also say, having worked in other states and working here right now, Monday through Friday, all the large PPS hospitals, we're meeting every morning to go over how each hospital is doing, and as they say, kind of balance the load to if one hospital is past capacity and another hospital needs help, to try to coordinate that the best ways we can. We also, each hospital has their own surge capacity. We also have a document together for the state surge capacity, and we're kind of going back and looking at that and bringing players in to review and figure out what are some of the best ways to move forward. But yes, a lot of the hospitals are more stressed than they usually are at this time of year, and that puts more panic into us, knowing that we're now going into cold and flu season, which is the typical time of year that hospitals see more people coming through. So, you know, it is concerning. The one real positive thing is the hospital administrators, the chief medical officers from these hospitals, the way to see how well they're working together for the best of Montana is really a great positive to see, and they've been fantastic to work with.
Just to follow up on Dr. Holtzman's comments from the local perspective, we do post on our website the hospitalization numbers, and we've seen those numbers breach the 100 level between our two hospitals, and has remained there fairly steadily for the last week or so. Our two hospitals, just as Dr. Holtzman said, have very extensive surge plans. They're executing. I think someone recorded.
And they usually are at this time of year, and that puts more panic into us, knowing that we're now going into.
Yeah, there we go. So anyway, as I was saying, our two hospitals do have surge capacity and plans. They work with their regional affiliate hospitals. Also in Yellowstone County, we've worked from the beginning on this pandemic in the Unified Health Command, which includes Riverstone Health, Billings Clinic, St. Vincent Healthcare, and Yellowstone County Disaster and Emergency Services. So we are able to coordinate activities and processes across our entire system, and then through their regional connections out in the region as well to manage the caseload.
This is Greg Lamont with Color 8 Television in Billings for Dr. Felton.
Greg, you can only call Dr. Holtzman doctor. I have not earned that right.
Oh, that's right. Okay. My question is, the numbers that I've been looking at are consistently turning out the same. One, it seems like women are getting it more than men. Two, the age group 30 to 49 is getting hammered. What trends are you guys seeing that you can point to and say, that you have a pretty clear idea of what the numbers are going to look like from day to day to day?
We follow the same thing that you're looking at, Greg, particularly the age groups. One area that we follow closely is our school-age population. And what we're seeing is, in general, it is that population, that 20 to 39 or 49 population that's out and about and more active. It's a working population. It tends to be a socially active population. That's why we instituted a couple things. One is we did set a hard limit of 25 person limits on gatherings, regardless indoors or outdoors, and regardless of whether physical distancing is available or observed. So that was one part. The other thing is we asked people to really, on an individual basis, to think about not only the density of their interactions. In other words, the number of people you interact with outside your household. We've asked people in Yellowstone County to limit that to 6 per week, and also to shorten the duration of those interactions so that we reduce the risk of spread across larger groups. So, we're back in the same boat that we find ourselves in over and over, which is the collective impact on our community really comes down to each one of us doing our part in terms of the things we've all heard over and over: maintaining our distance, wearing masks, watching hand hygiene, sanitizing surfaces, staying home when you're sick, limiting your interactions. Those are all things we need to do to change this current dynamic.
And two other things. You would agree that that it's pretty encouraging in terms of the school-age population, in terms of the numbers that are coming out of that group.
Yes, I do visit with the school superintendents on a weekly basis, and we look at those numbers. We've kept a fairly steady weekly rate of that 0 to 19 age group, in that sort of 12 to 15% range overall. So, that's been steady, and that's something we were certainly concerned about when schools opened. And
are you seeing a trend of women getting it more than men?
I haven't actually looked at that, Greg. We can take a look at that, but I haven't. No one's really brought that up, so we can take a look at that.
This is Denise Smith again with Northern News Network. I think this question is maybe for John Felton, but I had an employer just reach out to me asking for clarification when it comes to employees that have tested positive and quarantining and whether or not other employees that are in close contact with that individual need to also quarantine. Sounds like there's been some confusion between what employers are being told and as far as how to handle other staff after one of their employees has tested positive.
Yeah, and we do get a lot of those questions. So let me just walk through the process. When a person is test positive, they become a case, and that case needs to be isolated. So you isolate ill people for a period of at least 10 days from the onset of symptoms until they meet the definition of recovered. You quarantine people who might have been exposed and to find out if they're going to become sick. So the people that need to be quarantined are close contacts, and this is what the CDC just changed yesterday. So a close contact is a person who has been within 6 feet or less for a cumulative period of 15 minutes or more over a 24-hour period to a case in the period of time that person who tested positive would be infectious, which goes back to 2 days before the onset of symptoms. So when we talk to people who've been diagnosed and found positive, those are the questions we ask: is who meets that definition, and then those people need to go into quarantine. I think one of the things that has been confusing, and we get the question a lot, and this may be sort of what you're getting at, is what we call contacts of contacts. So if a person meets the definition of a close contact, the next level of people that they're in contact with do not need to quarantine, but the people who meet that definition of close contact need to be quarantined.
And then one more question. This one is for the governor. Governor, I'm just thinking about upcoming Christmas break with the university systems, and if you're putting any plans in place now to what it would look like for those students to be able to return to campus after the Christmas break, if there's going to be a point in time where you decide that no, they need to stay home again for spring semester, or what you're actually seeing on the campuses.
Yeah.
Thank you.
Yeah. Then a couple different things, one of which is that, in all honesty, what we'll be looking at during that time, it really depends on what we collectively are doing, right? That it's hard to be predicting what's going to be happening around the holidays. And we also know that, like, when we look at these numbers are alarming, but these are all new cases that have occurred, right, in the last 2 weeks prior to get us to the date today. So from that perspective, it really is the actions that we take as individuals and the actions that we take as the greater community is going to be defining what things look like at that point. Now, we have seen certainly positives associated to our college campuses, but we've also seen that our college campuses, at times, we're at not the highest number that we were, and I say that kind of at an aggregate level on our campuses, because we've also seen that as they follow the quarantining and restrictions along the way, that they're getting their hands around it. I think the report yesterday, maybe that was Tuesday, might have said that in our K-12 system, right, that there's been around 270 different schools identified throughout that either had students or staff with positives. But let's also recognize that of that, I think it was north of 80 of them have already cleared, meaning that they quarantined either some individuals or a classroom, and they're continuing on along with business. So it's the actions that we take in the upcoming weeks and months that will determine whether or not our campuses are open next year. I'll also note that many of the campuses, and speaking to some of the educational leaders, that have some concerns over not what's going to happen over the holidays, but even what's going to happen over Halloween. And trying to figure out ways to make sure that our younger Montanans are being as responsible as possible through that, not going to large parties, just so we can continue to curb and mitigate the spread of this virus.
Governor, I'd like to ask one more question about the you previously kind of put it in the ball in the county's court in regards to enforcement of these mandates. But why has the state taken the action in Flathead County as opposed to your county officials?
Yeah, and I mean, first and foremost, like these actions were in response to community members and community pleading for help. I mean, we saw even last week as leaders in the community say that more steps must be taken to get our hands around this virus, to both keep our businesses open, keep our schools open, which also then directly impacts the workforce along the way. And looking at that and looking at the concerning number of cases in that area. I mean, Montana law provides Department of Public Health and Human Services with the authority to address public health orders, and can be done certainly either at the local level or at the state level. And the ask continues to be for both the business community and others to take this very, very seriously. I mean, I think one example, an individual who's an employee that worked all day without a mask in close proximity at a business and found out that at the end of that day that they were COVID positive. Every one of the temporary restraining orders that we're seeking, it was a complaint-driven process, meaning HERD and local public health had heard many complaints about these businesses. So it's the most willful violators.